Okay, we're recording right now. All right, Ken, great to talk with you today. Thanks for allowing me to record this conversation.
Certainly, happy to.
Wonderful. So you were just telling me that you were definitely doubtful when we first met.
Very much so.
And you were doubtful because you saw
so many medical people, different types, the people with arthritis, the people with pain management, my own doctor, and chiropractors with just general therapy.
Yeah.
And
but what brought you in here? What condition?
certainly my feet and walking and or neuropathy, right?
Neuropathy. So
nobody could even not guarantee, but diagnose that quote for sure.
Gotcha.
But yeah, that's what it did.
And what symptoms did you have? Do you have pain in your legs and feet?
I had pain all the way up to mid-calf, down to my toes, my ankles, my feet, bottom of my feet, the tops of feet, and now it's just in my toes. And I was not an easy believer. I had to see it for myself.
Sure. And your balance was not great?
No, not at all. And that was something that crept in over a period of years. And I knew I walked with a cane all the time, but I knew that I had a balance problem, but never gave that thought because it's not painful like the neuropathy was. But the things that you were able to do for me was strange, but very helpful, and I'm just so pleased with the results of that. My balance is pretty good. I use a cane on uneven surfaces, and
but you don't have to use one all the time.
No.
Did you before?
Oh yeah, before. Even sometimes in houses and hotels or in classrooms, I would use a cane if I had to walk through different areas, like in a restaurant.
Yeah.
Between tables, I use a cane all the time.
And now you just use it periodically when you're on.
If I'm going to a football game with the grandkids and it's uneven with the grass and gravel, then I use a cane. But in the houses and restaurants and that, normally I wouldn't use a cane anymore.
Wow, that's fantastic. Now, what about the pain that you had in your legs and feet?
Before, it was fairly significant. It didn't ever seem to go away. I could sit, I could stand, I could lay down, and still felt it. I wiggle my toes and feet and things like that. Didn't seem to help that much. But now I don't have pain. I have a little bit of tingling in my toes and toward the ball of my feet, but not very far. Totally gone in my legs and my ankles.
Totally gone. That is wonderful.
Yeah, it is wonderful for me.
And you still have some residual in the toes, but the good part is we're just over halfway done with your plan. We're not even done.
Wow, that's great.
We're just having a conversation today.
It's 3 months. It's
yeah,
been 3 months.
That's wonderful. That's wonderful. So, well, I'm leaps and bounds. That's fantastic, and I'm glad to hear the good news. So, well, thanks for allowing me to record this conversation. I look forward to working with you, and we're not putting a limit as of today. We're not putting a limit on how much your nerves can heal. So, thanks, Ken.
Thank you.